You know, I started to really become aware of the depth of the opioid problem in Virginia in 2013. Recently, Governor McAuliffe and his health commissioner declared opioid abuse a public health emergency in Virginia. So I have been working on a couple of pieces of legislation about naloxone, which is a drug that can bring you out of an overdose, also about trying to curb overprescription of opioids, especially among seniors in the Medicare Part D program. But there's just more and more to learn. So this is a very unique program. It's for expectant moms who are dealing with opioid issues, and they're here until about 60 days after their babies are born. Sometimes the children are born with issues because of addiction, and then you got to work with both the mom and the child. But this is such a unique program. There's really not another one like it in Virginia. So I wanted to come and learn a little bit about how this works. And so we had this scheduled, and then I found out last week I'm now going to be on the Health and Education Committee in the Senate, where we will deal with all these issues. So I wanted to learn just, you know, because I felt like I could do some good things, but now I'm on the committee that will be sort of in charge of looking at the success of some of the things we've done recently. Is it working? A really good opportunity for me to come, and especially with moms and expectant moms, what does this opioid addiction problem mean, and what are the right strategies for dealing with it?
Do you have a takeaway? Anything from meeting these people today that you're going to take with you back to D.C.?
You know, so much of it is about the coordination of care. I mean, the community service board model is this model where you're dealing with physical health, you know, OBGYN visits for expectant moms. You're dealing with the court system. People have been through drug court programs, or they've been incarcerated when they come here. And then you're dealing with the behavioral health issues and the substance abuse issues, including medical assisted treatment. And there's a lot of different pieces to it, and you kind of have to have it work comprehensively for it to work. That's why you don't see a lot of these programs around the state. It's not easy to put it together where you can provide all these services, and this is the only residential facility of its kind for expectant moms in Virginia. So how to provide that coordination is sort of one of the key issues that I'm going to take back and kind of grapple with.
What was it like to be able to, see some of the patients here, know what they're going through, and to see that there are only a few of the people that are actually getting the help that they need in the state? Yeah,
this is a 16-bed facility, and again, the notion of a residential facility for expectant moms dealing with opioid or other drug addiction issues, and that you have this 16-bed facility, and it's it. I mean, and you heard one of the women say, I came here from jail. I didn't want to have my baby in jail. There was another expectant mom in jail, and she couldn't get into the program. She couldn't get into a program. So think about that, delivering a baby while you're in jail or prison. So, and let me now put myself in the shoes of the sheriff of that jail. Sheriffs all over the state, Hampton, Newport News, a sheriff in Virginia Beach, Ken Stolley, who's a friend, they tell me over and over again, why are we putting people with mental health issues in jail? Why are we putting people with substance abuse issues in jail? What they need is treatment. Now, if you don't treat them, then they'll do something that will be a violation of law. We have to put them in jail, but that's not really the problem. That's really not who jails were built for. And I'm pleased to say that our sheriffs are some of the best advocates we have for more comprehensive substance abuse and mental health treatment. And they'd prefer that the treatment happen before somebody needs to come to jail, but even if you can't do that all the time, then there needs to be more treatment for people in jails too. So many of the people in our jails are really dealing with mental health or substance abuse issues.
Senator Kaine, you talked about a visit like this helping you become a better advocate.
Yeah.
Are there specific things that you heard today that you're going to want to tell your colleagues in the Senate?
I think issues around, for example, issues around medically assisted treatment, methadone and Suboxone, these are often very controversial. They can be controversial in terms of whether people support them or not. They can be controversial in local zoning decisions about where they're allowed. But what you hear here is, hey, look, this is like if I had high blood pressure, I would get a prescription to take a statin. Or if you're high cholesterol, I'd get a prescription to take a statin. And nobody would hold it against me that I'm taking a statin to do with cholesterol. This is a physiological problem addiction. And one way to deal with the physiological problem is through this medically assisted treatment. So is there a way we can reduce the stigma associated with that? That's an important thing for us to take back. The other thing is, and they talked about here, this whole issue of the naloxone prescription. naloxone is a wonderful, I mean, it brings you back out of an overdose. And the amazing thing about naloxone is it doesn't have horrible side effects. So, for example, if you see somebody and you think, I think they're in an overdose, and you administer naloxone to them, and it turns out it wasn't an overdose, the naloxone isn't going to have a negative side effect. I mean, it's tough because it like puts you into a, cold turkey. You're coming out of an addiction and puts it into a very compressed period of time. So it's not a pleasant thing at all. But it's a drug that it's saved 26,000 people or more have had their lives saved because of the easier availability of naloxone. And we need to make it more available for first responders, healthcare professionals, families and friends of those who've had challenges. And if we do, we're going to save more lives. So that's one thing I'm definitely taking back.
The prescription with when an opium, you get the naloxone?
Yeah, so we believe, I have this bill that I got passed as part of a bill this summer called Co-Prescribing Saves Lives that basically says if you're getting an opioid prescription and you meet certain risk criteria, you should just get a naloxone prescription at the same time. It should be a co-prescription. The classic red flag would be if you have any history of respiratory problems, because an opioid OD collapses your respiratory system. So if you've already had asthma or other respiratory problems and you get an opioid prescription, you ought to get a naloxone prescription at the same time.
That picks up your theme earlier about we're not only talking about
so ending the stigma, and there are treatments. I mean, that was the thing Dr. Lowe said. Is this a problem? Yes, but there's treatments. Just like there are for other conditions. There's treatments, and we just need to make sure that people have access to the treatments. That's why some of the battles that we're going to have right out of the gate about the Affordable Care Act and potentially about Medicaid and Medicare are so important, because these are the ways we finance a healthcare safety net. And if we take big chunks of the healthcare safety net and weaken them or eliminate them, then it becomes more difficult for these services to be provided. One of the moms was talking about the fact, what is her worry? Her worry is when she leaves here, she won't be eligible for Medicaid. The state's rules about Medicaid are pretty tight. We haven't done the Medicaid expansion. Her child will be eligible for Medicaid through the CHIP program. But the CHIP program is one of the programs that could potentially be on the chopping block too, that in the health committee we're going to have to battle to make sure that we keep.
There's a lot of work to be done, really quick.
Yeah.
But I think for a lot of these women here, you kind of bring a sense of hope and a sense of relief. Do you have that? Do you foresee in the years coming with all this talk that we can really, make this better?
I do. I think here's one reason I'm an optimistic person generally, and I'll be able to do a better job advocating just because of coming to listen. I said I think I'm a good vote on some of these programs to try to do them anyway, but coming here will make me a better advocate to try to convince others to do it too. In terms of the hope, it's kind of the reverse of a bad thing. The opioid problem has gotten so bad. It affects every community, every age, every race, every income group. I looked at a chart, I'll just take a minute here, but it's so weird. I looked at a chart once within the last few months, states the 1 to 50 where the opioid problem is the worst, overdoses per 1,000. And it was unlike any chart I'd ever seen, because in the best 10 states, you had rich states and poor states. And in the worst 10 states, you had rich states and poor states. Anytime you look at something like that, it's almost always that the best states are the ones that are high income and the worst states are the ones that are low income. A problem like addiction or something like that often tracks with poverty measures. But opioids, no. It's rich communities and poor communities and urban and rural. It's everywhere. That has actually spurred us to some action instead of a problem that's kind of hiding because, oh, that's just in a rural part of the country or that's just in the inner cities. This is a problem that's touching everybody. And so we've passed 2 big pieces of legislation this year, one in July, one in December, to deal with opioid-related issues, because there's not a member of Congress, no matter where they represent, that hasn't had this. There are few families that haven't been touched by it. So in an odd way, the problem has gotten so bad that everybody now realizes, well, we have to do something about it. And so it's easier to, look at another member of Congress and say, look, I don't have to tell you about this. You've got this going on right in your neighborhood. I know that you do. So I think the dawning awareness of how serious this is the thing that gives me hope that we will, and with the passage of these 2 recent bills, that we'll keep doing more to try to tackle the problem.
Any other questions?
Yeah. All right.
Thank you.
Hey.
so much.